Good morning or good afternoon, everyone. My name is Saki Malik Cho, and on behalf of the National Center for Health and Public Housing, I would like to welcome you to the AMIGAS Cervical Cancer Prevention Program Learning Collaborative. This learning collaborative will provide some guidance on an evidence-based bilingual health education intervention program that's designed to train community health workers or promotoras to increase cervical cancer screening among Hispanic women. Before we begin, I have a few housekeeping items I'd like to go over, and the first is that this is a live video session. So this is the first time we've used this type of platform to deliver this kind of session, so we're really looking forward to having a wonderful and interactive experience for you today. We are recording this session, and we'll plan to have the slides and the recordings available on our site after this is over. But because we are recording, we've muted all of your lines. And we'd like to encourage you to use the chat function to ask questions or make comments throughout the session. And we'll have a formal Q&A portion at the end where we will review any of the questions that were made through the chat. You also have the option to raise your hand and ask a live question. So you could just click on the raise hand icon and we'll announce when the line has been unmuted so you can ask your questions. Okay, I'd like to introduce our speakers. For the session today, Dr. Jose Leon and Ms. Fide Sandoval. Dr. Leon is the Chief Medical Officer here at the National Center for Health and Public Housing. He has over 25 years of experience developing prevention and public health programs for underserved communities in the U.S. and abroad. He's had many roles during his career as a physician, a program manager, a medical call center manager, a health center manager, a medical advisor, and senior health information specialist. Dr. Leon has extensive experience at researching and assessing the healthcare needs of low-income populations and health center programs and providing evidence-based solutions to urban and rural clinical sites. Dr. Leon coordinates the learning collaboratives on cervical cancer prevention and diabetes management for health centers that are located in or immediately accessible to public housing. He received his medical degree from Alberto Mesfer Salvadorian University and has an MPH from the Catholic University in El Salvador. Our next speaker, Ms. Fide Pineda Sandoval, is a research assistant at the National Center for Health and Public Housing and provides analytical, technical, and logistical support to the team. Ms. Pineda is a certified health education specialist, and she has over 5 years of experience in providing direct clinical and administrative assistance to healthcare providers. Prior to joining NCHPH, Ms. Pineda worked at the Office of Student Scholarship, Creative Activities, and Research at George Mason University, where she collaborated with research on racial disparities in cancer treatment and collaborated in a culturally sensitive weight management intervention for low-income Latino youth and their families. I would like to note that this learning collaborative is brought to you through funding from HRSA. However, the opinions that are expressed here on this presentation are of our own and do not represent those of the Bureau. So now I'm going to pass it off to Dr. Leon to begin the session. I'm sorry, Dr. Leon, I cannot hear you.
All right, thank you, Dr. Cho, for the great introduction and kind introduction. And good morning to you if you're on the West Coast. Good afternoon if you are here on the East Coast. It's such a great pleasure to have this conversation about cervical cancer and cervical cancer screening directly aimed at the Hispanic population in the United States. So I'm having some technical difficulties. I cannot advance the slides. Can you please help me with that? All right, thank you. So as Dr. Cho mentioned, we are the National Center for Health in Public Housing. We provide training and technical assistance to community health centers located in or immediately accessible to public housing. According to UDS data, this is the most recent data, there are 107 public housing primary care grantees providing services to public housing residents. The health centers reported around over 800,000 patients served in 2018. And those located in or immediately accessible to public housing, the health centers located in or immediately accessible to public housing provided some numbers that they served almost 4.5 million patients in 2018. Why is this so important? Because 55% of those living in public housing are female patients. So these are young female patients that are around 20 to 55 years old, and who is one of the target population for the cervical cancer screening that we are going to review and develop and somehow develop the training for you guys. This is very important. Cervical cancer is one of the conditions that somehow we are putting in the back burner, I guess, due to other issues that are considered more important or new emerging issues. So this for this session, in addition to have a brief discussion on the AMIGAS program, we are going to discuss the fundamentals of cervical cancer prevention. We are going to identify some cervical cancer screening prevention methods, and we're going to list some goals of the AMIGAS program. So before we get started, we would like to ask two questions, very brief questions. And the very first question is in regards to the Latino population that you serve. The first question is, if we can put the survey up. Does your organization or your health center provide health services to a large population of Hispanic women? So we're going to give you around 30 seconds just to have an idea of the population or populations that you serve. All right, can we see the results?
Yes. We have 100% of the participants that said that they do provide the services.
Excellent. And our second question is, does your health center have a cervical cancer prevention program for community health workers? Have you developed any training for community health workers to address cervical cancer screening? All right, let's see the results.
100% of our participants have said no.
All right, so this is a great opportunity to have a discussion on an evidence-based program developed by the Centers for Disease Control and Prevention, CDC, and the Health Community Services Task Force. So this is a very good opportunity for you to get all the materials and all the information that you need to provide cervical cancer prevention to your female population in the clinics that you have. But before we get into the nitty-gritty of the discussion, I believe that we need to talk to a little bit about the anatomy of the cervix and what the cervix is. This is something really important because we are going to have some health literacy issues, I guess, when we have a discussion on cervical cancer with our Hispanic population. And first of all, I believe that it's really important to say the meaning of cervix, which is in Spanish is cuello or neck in English, and what it what it means is that the structure that we are going to have a brief discussion today has that neck shape form and is located between the vagina and the uterus. So that's the passage, you know, that comes from the uterus to the exterior of the vagina, and it has two sections, two main sections, which is the ectocervix, which is the external side or the external part of the cervix, and the endocervix, which is the internal part of the cervix. Why is this structure so important? Well, it's important because it has two main functions. One is a protection to the uterus. It protects against infections. So it's very important to know that one of the first functions is just to protect from infections. And the second main function is to allow the passage of semen during sexual intercourse. So those are the main functions of the cervix. And for some people, for some anatomists, they tend to say that this is a different or a structure, instead of saying that this is the cervix of the cervix of the uterus. However, in Spanish, again, when you have a conversation with someone who is a native speaker and who doesn't have a very good understanding of the anatomy of the cervix, they refer to the structure as el cuello de la matriz, which the translation should be the neck of the uterus, but that is more the cervix. That's what they are referring to, and we need to make sure that we have the same understanding and that we are talking about the same structure. And before we have a conversation about cervical cancer, we need to pause for a moment and have a brief discussion on the HPV infection. This is HPV stands for human papilloma virus. And the human papilloma virus is a small DNA virus. There are around 120 HPV, and the HPV, as the name says, only affects humans. So there is no other species or animals that can have this type of infection. So out of 40 of them can cause some lesions in the mucosal epithelium, which is the structure that is going to be infected, or part of the cervix that is going to be infected, and in the long run can cause cervical cancer. There are several out of these 40 HPV or human papilloma viruses. There are two in particular that are highly malignant. That is the HPV 16 and the HPV 18, and there are some other low-grade or the viruses that can cause benign lesions like the 6 and the 11. Most of these four are covered by a vaccine, the HPV vaccine or the Gardasil or CERVIX, depending on which vaccine you have available. And the idea is to prevent the HPV infection in people who are between the ages 11 to 26. However, why is this so important? As I was saying, and in the beginning, it's very important to know that cervical cancer is one of those health conditions that sometimes we are not paying enough attention to. There are several reasons. One is that it's not part of the top 3 or top 5 or even top 10 cancers affecting women in the United States. The 3 top cancers affecting women in the United States are lung cancer, are the colorectal cancer, and the second one is breast cancer. So it's lung cancer, breast cancer, and colorectal cancer. So that's one of the reasons why we tend to forget about cervical cancer. And even though the incidence and prevalence of the condition is low, it's still a public health concern in the United States. The second reason is that sometimes we do not have materials. We do not have information for the populations or for the high-risk populations, in this case, the Hispanic population. And sometimes we tend not to provide the education that they need. Going back to the HPV infection, this is the most common sexually transmitted disease in the United States. It is believed that around 40 or 50% of those who are unvaccinated can develop an HPV infection. So that's one of the reasons why if we can prevent first the infection, or if we screen our patients, then we will be able to decrease the number of patients, of female patients with cervical cancer. So the other part of the information that we are going to provide is about the epidemiology. We are going to discuss a little bit about the incidence and prevalence of the condition and the infection. And it's just, even though we are going to provide additional information, my colleague Fida is going to give some numbers, it's just worth for this part of the conversation to mention that in 2016, which is the year that we had the most current data that we have, around 11,000, we had around 11,000 cases of cervical cancer, and around 4,000 of them died in 2016. So that is part of the information that is very important to have in mind, in addition to the prevalence of the HPV infection, which is the most frequent STD infection in the United States, including more frequent than gonorrhea, syphilis, or HIV. So how is the disease or the HPV infection spread? And this is very important to know, because there is some misunderstanding. And when you have conversation with your patients, you are going to get some questions like if there is any other way to get the HPV infection other than sexual intercourse. And the answer is yes and probably not. There are questions as a provider. We have received questions like, for instance, you can get infected if somebody with a condyloma or a wart seated on a toilet, and then you go to use that toilet. And the answer for that question is no. I mean, you need to have direct contact with the lesions. There is no way that a hard surface is going to be the vehicle to transmit the disease. But if you have other type of contacts, like if you kiss someone and that person has a lesion, that's one way that you can get the infection. So the answer for that question is that you need to have direct contact, and most frequently, and more than 90% of the cases are due to sexual intercourse. So what are the problems, the health problems that you can develop if you have an HPV infection? Is most of the infections are asymptomatic. It means that you get the virus, and if you have a really good immune system, you are going to get rid of the virus. You are probably going to develop some antibodies or that is going to protect you against the virus, but and you are not going to develop the disease. However, on some occasions, you can develop some other lesions like warts, papillomas, and if you have, for some patients, they can go for years, with the infection until they develop some type of cancer. The most frequent one, and the one that we are having a discussion on today, is a cervical cancer. However, there is other type of cancer that the patients can develop. Some patients can develop anal cancer or cancer of the penis or the oropharyngeal cancer, depending on whether you had contact with those surfaces, with someone who's been infected with the disease, or with the human papillomavirus in this case. So let's get into the cervical cancer basics. As we said previously, there will be two types of cervical cancers. One is going to be located in the mucosal epithelium, and that is what we call the endocervix, and it's going to be another one that is located in the squamous cells of part of the ectocervix. So both, regardless of the location, 99% of these are related to an HPV infection. So in other words, if someone developed cervical cancer, is because they had a previous HPV infection, but not all HPV infections will develop and cause cervical cancer. So I believe that's the link and the association that we need to keep in mind when we discuss cervical cancer. And we have this video. I'm not sure if we can play it from here, or you can play it just to discuss the screening. This is a Centers for Disease Control video. It's a 15-second video.
It's been said that knowledge is power. So know this: you can prevent cervical cancer by getting screened. How's that for powerful? Take control of your health.
So that's the key message for this session and for the next sessions, and that knowledge is power. We need to educate our patients, specifically the Latino population. Again, we are going to give some numbers on the patients, female patients affected by cervical cancer. But different literatures, the different reviews that we have done show that there are two reasons why the Hispanic population do not get screened. One is the lack of information in Spanish, and the second one is cultural competency and some beliefs. So cultural beliefs are very, very important, and you need to have a conversation with the Hispanic population to know the reasons why sometimes they do not get screened. We have had discussions with our clinical quality work group about some of the myths, for instance, about not getting any screening. And one of the issues, I believe this is one of the most important ones based on the information that we have collected, is that women, Hispanic women in particular, do not like to be screened by a male physician. They prefer to get screened by a female physician. So those are the kind of consideration and education that we need to provide to patients, that regardless of who is screening, these are healthcare professionals who have received the training and have the knowledge to do all these kind of cervical cancer screening. So this is very important. Going back to the screening, we have two main tests. One is the PAP test, and the other one is the HPV DNA test. These two are important. For the HPV, the first one can be done or is recommended for patients who are 20 to 65 years of age. The other one is recommended for patients who are 30 to 65 years of age. If the patient only receives the PAP, then the patient needs to be tested every 3 years if the test comes, or the result comes back negative. However, there are other guidelines that probably we are not going to discuss today. But for the other tests, if you screen a patient 30 or older with both the PAP and the HPV DNA, and the tests come back negative, then the recommendation is to test patients every 5 years.
It's been said that knowledge is power.
So how does HPV cause cancer? Basically, there is an infection, and an infection always produces inflammation. An inflammation, chronic inflammation, is the key to develop any kind of cancer. It's part of the pathophysiology of cancer, that there has to be some inflammation first, and specifically when we're talking about this type of cancers. I mentioned previously that there are two in particular, two viruses, the HPV 16 and HPV 18. The HPV 16 causes around 50% of all cervical cancers, and both the 16 and 18 are linked to 70% of cervical cancers in the United States. So is this condition preventable? The answer is yes, it is preventable, but HPV is only, or cervical cancer is only the tip of the iceberg, because as we mentioned previously, we have other either precancerous conditions or other cancers that are caused by the human papillomavirus. So these are some numbers that probably we're going to discuss next. We have other lesions like the cervical. I mean, there's different levels, level 1 and 2. Those are considered precancerous conditions, and those can, if not screened, then they can develop to cervical cancer. There are, as we mentioned, there are other HPV cancers. We have cancer of the penis or penis cancer. We have oropharyngeal cancers. We have anal cancers that are due to HPV infection. This is something really interesting too, because if we screen women, we are able to help male patients that can develop any of these other HPV cancers. The other part of this discussion that is really, really important is to mention that the LGBTQ community can also be affected by an HPV infection. And then this is another high-risk population that we need to take into consideration when we provide some training, because these are some of the high-risk populations in addition to the Hispanic population. The key terms that I believe that we need to review before we go to the AMIGAS program is that in order to develop cervical cancer, first you need to be infected by human papillomavirus. There are around 120 of them. 40 of them can cause lesions in the mucosal epithelium, and the 16 and 18 are the most frequent ones in the United States. That there is some ways to screen patients for both from an HPV infection and for cervical cancer. That there is a vaccine that probably is not part of the discussion today that we can use to prevent HPV infection, specifically for our patients who are 11 to 26 years old. We have a quadrivalent vaccine that is the Gardasil vaccine, and we have a bivalent vaccine that is CERVIX. The quadrivalent vaccine is recommended for both female and male patients, and the second one is only recommended for female patients. And that education is the key to prevent cervical cancer in all populations, and specifically in the Latino population. So I'm gonna now turn the presentation over to Fidel.
Thank you so much, Dr. Leon. So as Dr. Leon was discussing earlier about cervical cancer, now we're going to talk about the AMIGAS program. So AMIGAS stands for Ayudando a las Mujeres con Información, Guía y Amor para su Salud, which in English it stands for helping women with information, guidance, and love for their health. So this program is a bilingual health education intervention program that is culturally appropriate for the audience of interest, which in this case is women, Hispanic women. And it has been shown that it increases cervical cancer screening among Hispanic women. It is effective in providing cervical cancer screening among Latinas of ages between the ages of 21 to 45 years old. It was specifically designed to help promotoras or community health workers provide cervical cancer screening health promotion for their community. So why is the AMIGAS program so important? So according to the most recent statistics from the CDC, the highest incidence of cervical cancer happens among Hispanic women. So if we see in the first chart, the incidence rate for cervical cancer among women was 7.7 per 100,000 women. In this next chart, we see that the rate of new cancers was highest among Hispanic women as well when you compare it to white, Black, American Indian, and Asian Pacific Islanders. And the rate here was 9.8 per 100,000 women. So in this next one, we can see the trends based on age of cervical cancer. And then we can also appreciate the fact that cervical cancer starts to increase from ages 20 to 24, and it peaks all the way to 40 to 44 years old, and kind of steadily stays high all the way up to age 85 or 69 by staying with 10,000 cases of new cases of cervical cancer per 100,000 women. So the AMIGAS program is a proven health education model that was built from the Community Preventive Services Task Force, that one-on-one education increases Pap test use. It works with women who are experienced promotoras in their communities to deliver the education. So in this case, they would deliver education on cervical cancer prevention, the basics such as the ones that Dr. Leon went over in the previous slides, and also stresses how information and skills learned in the intervention will help women and their families and their communities stay healthy. It also provides culturally appropriate bilingual information. So that is one of the other components that we're going to learn during this learning collaborative. We're going to learn about all the resources that are available out there specifically that are bilingual, that are in English and Spanish, and these are going to be very useful to provide this type of health promotion. So the program also uses naturally occurring social networks to recruit women, and some types of these natural occurring social networks are community-based facilities such as churches. It could be also done, a lot of it is also done through health centers. For example, they do a lot of health promotion through health fairs, through national events or local events, or also through the use of their mobile units. Those are very effective ways for them to promote and recruit women to provide cervical cancer screening education. So what is the AMIGAS composed of? What are the tools that the AMIGAS program provides? So it has an administrator's guide, a promoter's instruction guide, a bilingual flip chart, contact sheet, evaluation form, handouts, and body diagrams. These are all very good tools that we're going to learn about in the upcoming sessions. So to start, we're going to talk a little bit about the administrator's guide. So the administrator guide provides, it's focusing mostly on providing information to program managers and administrators. It provides information on what steps to take to implement the AMIGAS program successfully. It also provides an overview on how the AMIGAS program was developed, which is something really good to know, to kind of have an idea of where, how the program started. And one very important aspect of this is that it actually started through health centers. So it is going to give us a really good example on how to implement this program successfully in health centers as well. So the administrator's guide also will show you the benefits of implementing the program, how to achieve screening goals among Hispanic women in the community. And the promotoras instruction guide is another very useful tool that was built specifically for promotoras and includes how to use the AMIGAS toolbox. So the AMIGAS toolbox is something that we're going to learn also how to put together. These are all tools actually that the promotoras are going to have to take to their communities, to take to Latina women and provide education to them and provide a list of resources where they can have access to cervical cancer screening. And also provides information on naturally occurring components, such as like how they can have access to like churches and community-based facilities. So now we're gonna get started with the questions and answers, and I'm gonna pass it to Dr.
Before we get to the Q&A session, we would like to remind those participating in this activity that we set up a website where you can get and download all the materials. Can you please just explain to them the URL, if you have it, and all the materials that they may have, or they can download from that website?
Oh, yes,
log in.
Of course. Can't go back. But so we actually also have, provided, I don't know if you guys were able to see the flyer, but in our flyer we included a link that provides how to access our Moodle account. And you would have to basically create a free account. You don't have to pay anything. You just create your account, and then you will also have access to all of our materials there. But we also have included it here on GoToWebinar that you can also just download it as handouts. But if you can't do it this way, then you can also go through Moodle.
And this is a very friendly platform. In addition to having access to the tools and resources, you can also ask questions if you have any questions. If you don't have any questions right now, but after the presentation, you say, okay, I forgot to ask this question. How can I get a hold of the presenters? So you can go to this platform and ask questions, and we are going to make sure that you receive the answers to your questions. So do we have any questions from the audience?
Yes, what will we be covering in the next 3 sessions?
Excellent question.
I'm gonna advance the slides. Thank you. So in the next session, we're gonna learn about the role of community health workers and what their responsibilities are, with a focus on the AMIGAS program. We're going to discuss the AMIGAS toolbox. We're gonna go over each of the resources, the purpose of it, how to put it together, and we're gonna learn how community health workers can be effective cervical cancer screening promoters. Do we have any other questions?
We do not have any other questions at the time.
All right, thank you. The other piece of information that we would like to provide is that we've been in contact with the Centers for Disease Control and Prevention. One of the questions that we asked even before we put together this learning collaborative was whether or not printed materials are going to be available. And in general, CDC doesn't provide printed materials. All the materials and resources that they have are online, and you can download it. And in the next sessions, we are going to have a conversation on some of the resources that you will have to laminate and some of the resources that you are going to need to go to the community and have this discussion with your female patients. So that's another piece of information that is very useful. And again, if you have any other questions, you can go to nchph.org. Let me just finalize our presentation. And this is how you can contact us. You can contact any of our staff members, and we are going to be happy to have a discussion with you on this resource or any other resources that we have in place. You can also visit our website, nchph.org, and you can get access to this recording or any other learning collaboratives on different topics such as diabetes, cervical cancer, women's health, and information about webinars and workshops. And soon we are going to have information on our National Training Symposium. The National Training Symposium will take place in Washington, D.C. in the month of June 2020. So we are going to provide additional information as we have more information for you. But also please visit our website, or you can also follow us on Facebook or Twitter.
Okay, we do have one more question. Can you explain a bit about the history of AMIGAS and why you selected it as a model?
Of course. AMIGAS is a tool, an evidence-based program that was created by the Centers for Disease Control and Prevention, CDC, and the Preventive Community Services Task Force. They saw the need of providing this training to the Hispanic population. As Fide mentioned, the prevalence of cervical cancer in the United States is around 7.7%, and the prevalence in the Latino population is almost 10%. So it's more than 100%. There is an increase of more than 100% when you compare the U.S. total population and the Latino population. The other reason is the number of female patients that community health centers provide services to. The public housing primary care grantee report around 55–56% of their patients are female patients. And when you look at public housing data, specifically data that we have from HUD, the number is very similar, and these are low-income population. Most of them are underinsured or have no insurance, and those are the reasons why some patients do not have access to appropriate cervical cancer screening. So those are the reasons why, as a national cooperative agreement, we made the decision to provide this training. This is an evidence-based training that it was created by one of the most, if not the most known public health organization in the United States.
And we do have another question
Sure.
for you. Has AMIGAS been successful in improving the number of adolescents, male and female, that received HPV vaccine?
Excellent question. There is no research, or at least I haven't seen any research comparing or trying to get information on whether or not the program is very useful for the use of the HPV vaccine. You know, this is more about the screening. The program is about the screening, specifically the use of the PAP and the HPV DNA. Is not is training about the use of the HPV vaccine. That's something that we can discuss in one of the next sessions because it's a different topic. But this is more the training is focused more on providing information to female patients about cervical cancer screening.
We have one more question
Sure.
for you. Is CDC or any other entity evaluating AMIGAS now or in the past?
That is, you know, there are several organizations that have been working on this particular evidence-based program. I haven't seen any data on how effective the training is, but what I can say is that most of the organizations, public health organizations, somehow support the training, and including two health centers. One is the Yakima Health Center, which, by the way, is a public housing primary care grantee, and there is another health center that they have been working on the AMIGAS program. What I can do, or what we can do, is to get a hold of the health centers and have a brief conversation on the AMIGAS program and how effective the program has been in the community. And we can provide that information in our next sessions.
I would like to add something about it. So it did, part of the results that they obtained when they did the first pilot study on this program was that there was an increase actually of 33% cervical cancer screening among all the communities where they implemented this program. So it did show for it to have been effective. So.
We have no other questions at this time.
All right. We would like to thank all the participants. I hope this information has been useful. And the next sessions will be more useful because we are going to get into the resources and all the information that you need to go to the communities and provide these preventive services. We would love to work with you in the future. I mean, if you decide to implement this training and probably do our own research and see how and prove whether or not this is an efficient tool to provide preventive services to the population that you serve. Thank you so much for being with us today. Good afternoon and have a great day. See you in a week.
See you.